Thank you, Annie. Well, hello again, everybody. Thank you for joining us and welcome to day 2 of the Voices for Healthy Kids Preemption Convening. As mentioned, I am April Wallace and I am the Advocacy Partnerships Manager. I focus primarily on leading and guiding the overall health equity strategy for Voices for Healthy Kids. So I want to acknowledge the very full yet enriching day we had of learning on Tuesday afternoon. It was lots of content and a lot of research to digest, but I hope that you have had a little time to recharge and sit with the information. And I hope that you are ready for more, because today we are going to unpack health equity messaging. In thinking about the Voices for Healthy Kids equity strategy, we have begun to think about the ways in which preemption perpetuates the health inequities experienced in many Black and Brown and lower income communities across our country. As we move forward, we are excited to continue to invest in the incredible preemption work that's being done by many of you and within locales across the country. We, of course, are committed to the integration of equity and in the very fabric of our everyday work. And we recognize that as advocates, we have an obligation to elevate equity first in all policy work, all policy solutions. So just in thinking about when we turn our TVs on every day, when we log on to our social media accounts, we are inundated with the news and the updates about this second wave of COVID-19 and the infections that are surging nationwide and disproportionately, of course, affecting Black and Brown and low-income communities. And we also know that there are some state and federal government officials who are not in agreement, alignment with the most effective way to keep our communities safe during this pandemic. We see the headlines daily and that recall and highlight really the discord between state and local jurisdictions that in many instances hinder the local officials from acting in the best interest of its constituents. But as we continue to fight for health and safety of our communities, we know that repealing local preemption allows our local governments to establish guidelines and protections specific to public health needs and conditions, thus really intrinsically advancing health equity and critically addressing the social determinants of health. So when we think about the people who are most impacted by poor health outcomes, we must consider how we can resolve these challenges by working to create equity in all policies. We use preemption repeal as an opportunity to bring together traditional and non-traditional partners in communities to build political power and create long-term change. Through organizing, engagement, education, we can truly reach a common understanding about the systemic issues and then work to deepen understanding of the needs and the experiences that will lead to the policy changes specific and respective to the local environment. So today, we're going to explore how we form the messages that we need our decision makers to hear, but we will also explore how we are approaching building capacity for grassroots organizations, delegating power, and positioning advocates and community leaders to work with elected officials to advance health equity and decrease health disparities. So as we kick off this jam-packed afternoon with the Metropolitan Group and We Collab, we hope that the tools and the resources that we share today will resonate. And should you have any questions or want to have any follow-up discussions based on your learnings today, we welcome the opportunity to continue the dialogue. And after the convening, think about what support, how we can support you as best we can. So now let me just quickly do a check-in here. And I think we now have an activity that we want to kind of poll to get some information back from you. So on day 1, just kind of recapping, think about what was most important, what was most significant for you, what did you learn? And if you can capture that in, I know 1 or 2 words is hard, but maybe a short sentence, we'd like for you to respond to our poll EV, and we will kind of generate our word cloud for the day. So I'll give you a minute. All right. So we have some good stuff popping up. Community, yes. Intentional, yes. Storytelling. Language, yes. I'm trying to follow here. Person first, yes. Lawmakers. Patience. Framing, yes. Communities, yes. I'm so bad at following this. Empowerment, yes, I love it. Collaboration, there we go. So really, really good thoughts about what we heard and what we talked about on Tuesday. So today is just going to be more of this and more of talking about how we look at these communities and how we work and build from the ground and really talk to our elected officials. So I am now going to toss it to Rena, I believe.
Hey, April, sorry. I hope everybody is doing well. Thank you again for joining us on our day 2 of our preemption convening. We're really excited to be back together with everybody. I want to take a moment to thank our funders who have helped make all of this work possible. The Robert Wood Johnson Foundation, the Rockefeller Foundation, and the Annie E. Casey Foundation. And again, I want to thank all of you for being here with us today. I want to do one thing, just as April said, just a little warm up. I know this holiday season for many of us is probably not kind of what we are used to, and there's a lot of challenges, but I was wondering if people could just take one moment to just throw in the chat box for some good vibes today, just one thing that you are thankful for as we go into our week of Thanksgiving. And I thought that just might get us, we're a week out, and it might just be some good vibes for folks. So I see a lot of family, dogs. Yes, dogs have been critical through this year. Health, absolutely. Thanks, Erica. Employment, yes, very lucky. Free time, a comfortable home. Sense of humor is key to getting through all of this. Heat, yes, I don't know about you guys. We are in Boston today and it is winter all of a sudden. We've had snow, 70 degrees, and back to winter in the last 3 weeks. Best colleagues, thanks, Lori. Kids, partners. Yes, toilet paper is back in stock. Though I will tell you, my husband went to Costco yesterday and it's running low, so people might want to take advantage of that. Your daughter and family. Thank you. Thanks for doing that. I just, it's good to remember all of that stuff. And I think disinfectant wipes, that is Chris Roller. That is like gold these days. So again, I just wanted to take a moment and just be grateful and send some good energy to everybody, because I know we're going into a hard time here and we really appreciate folks spending their time and days with us. We know folks are juggling a lot. So I see we have our speakers here. So we are going to dive into our next session. So again, I'm Rena Singh, Director of Campaign Planning and Communications at Voices. It's nice to be here with all of you. Again, my pronouns are she, her, hers. I am here to kick off our next session. So today we are joined by Jennifer Messenger and Shakira Hill-Taylor from the Metropolitan Group. We are going to talk about the Voices for Healthy Kids, Health Equity and Public Policy Messaging Guide for Policy Advocates. We're going to walk through some of the early findings from some of this message research that we've been doing over the fall. And we're going to talk about how we can add this to your communications toolbox and pair it with some of the preemption specific messages that we heard from Hadaway on Tuesday. Just to give folks a little bit of background about what this tool is, some of you may hopefully have used it in the past, but in 2017, 2018, Voices released this guide that we did create with the Metropolitan Group. The guide was created specifically for use by policy advocates to use with decision makers to help create language within policies that prioritize where the policies should be implemented first, with a focus on that the implementation should take place in communities where the needs are greatest before being applied more broadly. So fast forward to 2020, here we are. Voices has continued our work on equity, and we had decided we needed to update this guide to reflect more where we are and where we want and need to be. So we are again working with our friends at the Metropolitan Group who are helping to update this research. They've been wonderful partners, and we're thrilled to have them here with us today to walk us through everything and to do some activities with us. So please join me in welcoming Jennifer Messenger and Shakira Hill-Taylor from the Metropolitan Group, and give them a round of Zoom applause if you can. Thank you.
Rena, thanks. Shakira, before you dive in, Andrea, will you stop screen sharing and I'll just switch over to screen sharing so we can show our slides? Thank you.
Also, everyone can get a moment to see our faces. I know it's a little more challenging to see when we're screen sharing.
Hang on one second. Let me just make sure I get the right screen going here. Are you seeing the slide?
We are, and we're seeing the preview version. So FYI, Jennifer.
All right, hang on one sec.
Yep, perfect.
All right.
Thank you, Jennifer. Awesome. Hi, everyone. I'm Shakira Hill-Taylor from Metropolitan Group, joined by my colleague, Jennifer Messenger. We're really grateful for the opportunity to be here with you all today. Rena has given such great context, and I just wanted to add in, layer into that a little bit more. We're here today to preview an upcoming messaging guide that will support you to discuss racial equity in public policy and to make the connection between policies and systemic racism, and to show how focused policy language can be a solution. And so, as part of this conversation, some of you may have been here 4 years ago when Metropolitan Group worked with Voices for Healthy Kids on the original Health Equity and Public Policy Message Guide. That guide and the research messages it contained focused on securing specific policy language about where and how to implement first to advance health equity. Where the initial guide outlined a way to have this conversation without being off-putting to decision makers, the goal of the update is to be more overt about racial equity messaging. This is a direction the Voices team has been heading, and it went from need to imperative after George Floyd was murdered, and as we watch COVID-19 ravage communities experiencing the impact of structural racism. This is an exciting shift, and one that now feels even daunting to some of our grantees and partners. So this guide is intended to support people on their anti-racist journey and build their skills to have these direct conversations. So let's talk a bit about the goal of this guide. So this is a great companion to the preemption conversation you've been having over the last couple of days. The need and opportunity to focus policies where the need is greatest, especially in communities experiencing structural racism, is precisely why communities need the ability for local action and decision making. Preemption is a tool of oppression. It suppresses local voice, need, and self-determination. So our goal when we set out to update this guide is to advance the conversation on racial equity, link racial inequity and systemic racism to policy, obtain specific racial equity language in policy. So where you don't have preemption, you can use these messages to build racial equity provisions into public policy. And where you're fighting preemption, a motivating message can be the opportunity to address racial equity. We'll talk about how to use these messages both ways. So first, let's take a look at how the messages started to come together, the construction of the messages. All right, so we started by revising the messages in the last guide to center racial equity. And we tested and evolved those draft messages with various groups of Voices for Healthy Kids and American Heart Association staff, grantees, and partners. Some of you here today have been a part of those testing conversations. So thank you so much for the insights and contributions you've made in the build out and evolution of these messages. Finally, we've just come out of the field from policymaker testing, and a really important note here, we are not softening these messages to make policymakers comfortable. We're seeking to understand how to deliver them in ways that maintains our conviction and makes them most effective. So we just wanted to italicize that point. So our testing included one-on-one interviews with policymakers focused on racial equity to hear how they think the messages would work with their colleagues on both sides of the aisle. And we also conducted a national survey with a little more than 100 current and former policymakers and policy insiders led by a partner called Prime Group. So we're going to dive into a little bit of what we learned, which is really exciting. All right, so from our testing, two distinct audience groups emerge. One audience group that we're calling our early adopters. These individuals are progressive, they see systemic racism as a problem, support targeting policies where need is greatest, especially in communities of color. And our second group that right now we framed as skeptics, we are looking at what are some other ways that we might be able to categorize this group, but for lack of a categorization at the moment, we've labeled them as skeptics. These folks lean more conservative. They don't necessarily see systemic racism as a problem. They believe policies should benefit everyone. And just want to note here that they're not necessarily against us or our policies. They're just probably in the pre-contemplation mode when it comes to racial equity. So we just want to be careful there in how we're approaching both how we see these individuals and how we're labeling them. So I just want to add some context to the findings that we had for each of these groups. Nearly all early adopters and a solid majority of skeptics think people who are white enjoy at least a fair amount of benefits not available to people of color. They see causes of racial inequities. So about half overall believe systemic racism is most responsible for racial inequities. Skeptics are more likely to point to other factors though, including personal behavior or choices, culture and family situations, lack of access to jobs, which one could argue is a part of structural racism. It may be that people are recognizing the impact, but not wanting to embrace the term and broader concept. And then nearly half of all respondents say recent government policies in their community have both contributed to and helped alleviate systemic racism. The other half are evenly divided between thinking policies more often contribute or more often alleviate racism. So we're going to talk a little bit about what types of values we saw emerging from our testing. When people make decisions, they first rely on their values. I'm sure that's not new to anyone in this group. That's the lens through which they interpret facts and make sense of the world. So understanding these values is essential. So our survey found that when we look at skeptics, some of the values that we see coming through are stewardship of public funds, personal liberty. When we look at early adopters, they value equity. And then somewhere in the middle here, we have opportunity, the value of opportunity for people in the community. All right, so when we started to then play around with some of the messages and how the message construct comes together, our core message, start with the communities that have the greatest need and then expands, works. This was a key finding in the last guide too, which was built on the concept of targeted universalism. This makes sense for both those concerned with effectiveness of policy and those concerned with equity. We can't do everything at once, so we need to start where the need is greatest. All of the messages components we tested, which explored perceptions of health disparities, access to healthy options, impact of systemic racism, opportunity to use policy as a solution and otherwise, and other issues, were persuasive. So we use a testing methodology with the prime group that asked respondents to rank each message against competing messages. They did this multiple times in every different combination. So ultimately we can see which messages work in best combination to appeal to the broadest audience overall and with each targeted subgroup. So you'll see here we have the start up. Sorry, I was just unpacking a bit more. All right, so nope, you could go forward. Sorry, Jennifer. So here we have just sort of like a pie chart construction to show how this comes together, right? For the early adopters, 48%, when we use the unfair policies that shape physical, economic, cultural, social environments, have resulted in poorer health, lower income, higher medical costs, and loss of opportunity for people of color. That got at 48% of early adopters. So then when we add on the new policies cannot undo the damage from earlier discrimination, but they can advance health and prevent future harm, that gets us a broader slice of the pie. And then when we add on message number 8 to this chart, when people make decisions about their health or the health of their children, we should be sure that policies are not limiting the options available to them. That combination of messages gets us at 85% of early adopters. And when we use the same technique for skeptics, arriving at a message combination, a different message combination arrived at 97% of skeptics. Again, these messages are built using the direct points we want to make about structural racism, but in a way that feels most effective for persuasion. All right, so here's where we currently are with the message platform. It's important to note that this is still a draft. We're making final adjustments based on input we've received in our final round of testing and evolution with the Voices for Healthy Kids team, the AHA staff, grantees, and partners this week. And of course, this still needs to be customized with the communities most affected in your areas. There are places and markers in the message platform that you'll want to add specifics to align them with the policy you're working on, the specific asks you're making, and the local community's needs. But we wanted to show you the current construction of these messages. And before I kick it over to my colleague, Jennifer, we just wanted to also walk you through some of the, Jennifer, do you mind advancing to the next slide?
Yeah, I just wondered if you want to maybe read through one of these or just give
an
opportunity. Yeah, just so people can really absorb the messages.
Yeah, absolutely. So for our skeptics, again, we flagged the value drivers for each of the groups that emerge from the findings. So for our skeptics, stewardship of public funds, personal liberty. We start with the first message. We will know that we have achieved health and racial equity when race can no longer be used to predict health, well-being, and longevity. And then we go into our second message, unfair policies that shape physical, economic, cultural, and social environments have resulted in poor health, lower income, higher medical costs, and lost opportunity for, and this is where you would insert the group or community categorization that is specific to your community. That's systemic racism. When people make decisions about their health or the health of their children, we should be sure that policies are not limiting their options available to them, together with, and then you can add your specific community here. We have an opportunity to make this policy most effective by focusing first where it will meet the greatest need, then expanding to benefit all. The policy language needs to specify, and then we've included different types of calls to action that you'll want to include as part of the messaging. For our early adopters, the language goes a little bit farther. And so we start at the same place. And again, remember that value driver is equity. And we say that unfair policies that shape physical, economic, cultural, and social environments have resulted in poorer health, lower income, higher medical costs, and lost opportunity for insert your community. New policies cannot undo the damage of structural racism and ongoing discrimination, but they can advance health and prevent future harm. When people make decisions about their health or the health of their children, we should be sure that policies are not limiting their options available to them. And then similar to the last, together with specific communities, we have an opportunity to take a step towards racial equity with this policy by focusing its benefits in communities where structural racism limits options and leads to worse health outcomes. And then this is where you would plug in, this policy language needs to specify, and then your ask and call to action here.
Shakira, do you mind if I weigh in with just a couple more things?
Sure, of course.
So one thing is that we realize that, and this has come up time and time again in our discussions with staff and grantees, we can't just hand these messages over to people and say, good luck, go talk about structural racism. We know, and we have heard from you and many others, that this needs to come with a lot of support on everybody's own racial equity journey, comfort in talking about this, comfort and understanding about who delivers these messages and how who delivers these messages is going to be a coalition conversation that you're having in your community. Voices is really making a strong commitment and charge to grantees and staff that an imperative is to advance the conversation about racial equity. Mm-hmm. And we know that you all, as advocates and folks working on the ground, are also focused on passing policy and working in coalition. And this is a balance, and you're going to have some hard conversations and decisions to make around your strategy for each policymaker about where they're entering this conversation and how far you can push them and where you bring this in. And what we're trying to move away from is the reaction that might be, I'm just not sure this person is ready for this conversation, and having this conversation might derail the policy, and so I'm just going to not go there. We want you to go there. And at minimum, we want you to go there in the blue column. And really, we want you to get all the way to the green column and maybe even farther. There's no one way to have this conversation. You might be dancing back and forth between these columns as you get to know the person and your relationship deepens. But the point is to really be overt about these messages. The other thing I'll say is that what Shakira said at the bottom about really specifying your policy ask, you can't just say, let's focus this policy where the need is greatest. You've got to help define that with the community. And so one of the things we know we've got to provide with these messages is insight about how you would figure that out. How do you decide where the need is greatest with the community? How do you articulate that? What exactly are you asking for? And so one of the tools that will come along with these messages is some insights and references from the Voices for Healthy Kids policy team about how you really specify this ask. So again, this isn't just go read these messages. This is going to take some work to align these messages to your issue, whether that's a focus on local action or a specific policy issue, and then also getting super clear about what you're asking for in terms of focusing the polity to address structural racism and build racial equity.
Awesome. Thank you, Jennifer. All right, so in addition to testing the messaging, the broader messaging, we also analyze a set of proof points, and we've arrived at 4 that are most persuasive across both groups. I'll walk through those in just a second. We intend to include them in the final message frame. Where they best fit. So the first is the COVID-19 pandemic showed that disparities in health, economic, and social conditions put people of color at much higher risk of illness and death than white people. Even with the working poor, people of color are at a greater disadvantage. At every income level, people of color have worse health outcomes than others at the same income level. A global bank estimates that systemic racism faced by Black people over the last 2 decades has cost the US economy $16 trillion, including gaps in wages, access to housing, and higher education and investment in Black-owned businesses. Historically, policies have placed people of color at a significant disadvantage by denying education, mortgages, loans, and health benefits provided to white people. So that was a lot to take in. I want to pause for a moment, take any questions or comments before we take a look at how these messages might augment your preemption work. So would love to open it up for questions, comments, and conversation before we move on.
Shakira, you okay if folks just take themselves off mute or put something in the chat, either way?
Yeah, either way, if you want to chat or take yourself off mute, both are fine.
So we'll help keep an eye on the chat for you, but folks should jump in, take yourselves off mute if you have a question.
No questions? Well, how about I toss out a question for the group? Was any of what you've seen articulated in the messagings, in the findings as we tested with policymakers surprising, or did it affirm any things that you've already been experiencing in your work with policymakers?
Can you pull those messages back up or flip back on some of those slides?
Yeah, if we want to go back to slide 9. So it looks like Petra dropped in the chat. I think it affirms it, at least among some of the groups I've had to interact with in this work. Interesting. Oh, Sean said definitely affirm. Yep. Rena.
Do you mean it affirms what you've been saying, or it affirms what you think needs to be said?
Sean, it affirms what we've been saying, which is fantastic. It's especially, really focusing on the both early adopters, I think, because we have been working with communities that are early adopters. And then I really like the way you framed for skeptics. I think that's really great.
Shakira, this is Ellen Bravo from Family Values at Work. I really appreciate this so much. I was there 4 years ago, and I really appreciate this shift. And I think a lot of people in the room do too. I just want to ask, this goes to the slide that follows, where you use the word disadvantage. And I wonder if there's been any of the research looking at that word, because I think Rashad Robinson has written some great stuff about the word vulnerable, and disadvantage is like that, and that it's better if we use words like harm. That it's not you're not lacking in advantage. You've been harmed, and it makes it seem like it's luck. And this is just the opposite of what these messages are doing, which is so great. It's policies that have placed people of color at significant harm, I think, by denying, et cetera, et cetera. So I just want to throw that out as something, see if you have research, and if not, if that's something that you think is worth exploring.
Yeah, and it looks like others are agreeing with what you said. Thank you for articulating that, Ellen. We didn't specifically test the word disadvantage, but that's a great point. I think we've seen in a lot of the readings that we've been doing and research that we've just broadly been doing as we've been looking more closely at racial equity and what types of definitions and language and words are the most appropriate. And I've seen some of that come up in other types of conversations when you look at words like poor versus low income. So I think that's a really great consideration that we're noting.
Someone yesterday in one of the groups we were in commented on, I'm trying to think now which proof point it was about. Anyway, this bigger conversation about asset framing has come up a lot. And I mean, I know you all as advocates understand really clearly the need to both continually illuminate disparities and not reinforce disparities either internally with communities or to perpetuate a narrative that shifts to individual responsibility too much. So we committed to taking another read through this. We wrote this with an asset frame, but I think now that we've been away and testing it for a little bit, going back through with a real asset lens. And I think, Ellen, what you just pointed out is a really good one. We often like stay away from disadvantaged, marginalized, vulnerable, any of that kind of terminology. And so I really like where you went with this, with harm. One of the things too, oh, I know what it was that we were talking about yesterday was about this message about unfair policies that shape environments have resulted in poorer health. The conversation was about the fact that policies affect people differently, and really talking about even a policy that's not built to be unfair can have a different impact depending on where the community is, and really telling that through an asset-based lens. So there's been some really great, that's why these messages are all still draft. We've just gotten such great feedback, and I appreciate another reminder to really be asset focused.
Absolutely. Any other questions or comments folks wanted to share? All right. Well, Jennifer, I think I can turn it over to you.
Thank you, Shakira. And just to all of you throughout the conversation, and we're going to go into breakout groups in a little bit, your questions and feedback are, our intention is to give you all space and opportunity to think about and play with these messages a little bit. And we're still finalizing this. We're going to roll this out with a training in December and then release the full guide and an online sort of companion resource kit in January. And so you can help us continue shaping and fine tuning. So please don't hold back on questions or comments that you think would make these stronger, or places where you think you or others might get stuck. And your reinforcement of what's really affirming and helpful is super helpful too. So we had two objectives today. One is to just bring you a preview of this research and these messages overall. And now I'm going to shift to our second objective, which is to play with this in terms of your preemption work and efforts to control and restore or protect and restore local action and local decision making. And so the challenge that the Voices team threw to us was, if we take the preemption message research that Hadaway shared with you a couple of days ago and marry it with this racial equity messaging research and the objective to get specific provisions built into public policy to advance racial equity, what does that look like when we come together? So we were really seeing a nice synergy here as you're looking to protect local action. And I'll show you kind of how we played around with this in a minute. Again, this is like, I wrote this yesterday and we just talked about it with the Voices staff. So help us, please fine tune this. The one thing I'll say is that I know your campaigns are all different depending on the issues that you're working on. And sometimes you might specifically be talking about protecting local decision-making and local voice and removing preemption as your call to action. You might also be focusing your messaging on the specific issue that's being preempted and making the case for why local action is so important around a SNAP policy, say. So how you adapt and use these messages to your own policy campaign will vary. What we're going to show you today is really how to address directly maintaining local action and decision making. Okay, so let's take a quick look at this. And first, I wanted just to put up a refresher of what you heard from the Hadaway team on Tuesday. So they shared some of the key pillars of preemption messaging, including the statement about local action, the statement about local impact, and the statement about local knowledge. So those are the pillars that they shared with you. And then they also, I think, talked a little bit about some final tweaking testing that they were doing on equity lens. and really pointing out that when states strike down city laws, that silences voices of people of color who tend to have more access to decision-making positions and hold office at the local level. And that local communities have to be able to take action to fix rules in their city that have racist outcomes or racist implications without having to wait for the state to take action. So that's what you heard about and workshopped on Tuesday. And then when we took this and squished it together with the racial equity messaging, here's what we got. I know there's a lot on this screen. I'm going to walk through it with you. And we also have a worksheet that you can use, or a handout that you can use once you get into your small groups. So these are the messages that Shakira walked through with you before. And the red is where we inserted pieces of the local action and stopping preemption messages. So with the skeptic audience, the folks who aren't quite there yet or not really in the conversation, comfortable with the conversation about racial equity and structural racism, we start in the same place with this message that works about how we will know that we've achieved health and racial equity when race can no longer be used to predict health, well-being, and longevity. We still go into this point about there are policies that are creating disparities, and that is structural racism. And then we're going to talk about why that matters in a preemption and local control context. So local communities need to be able to take action to fix these rules without having to wait for the state to take action. And states should provide a foundation to build on, in providing basic protections so everyone is treated fairly. And then local governments have to have the ability to strengthen those protections based on what they know about their communities. So if you're in a conversation, oh, I'm going too fast. Thank you for telling me. So when you start to describe in your conversation the fact that there are unfair policies or policies that are having an unfair or unjust or different impact for people based on conditions of community, you can layer into that the opportunity to fix those rules and reinforce the point that that has to be done at the local community level. It has to be done in partnership with local communities in direct response to community conditions. That's where we're bringing in the local action message. Then we go to the next message. When people make decisions about their health or the health of their children, we should be sure that policies are not limiting their options available. Again, that was a message in the previous frame. And here's where we can layer in the local action message. So we know from what Hadaway shared that this idea of local communities and local government working together resonates. So we say when local communities and local government can work together, we can make this policy more effective by focusing first where it would meet the greatest need, then expanding to benefit all. For example, we'd be able to specify in the policy language, and here's where you're going to bring in those indicators that you want in the policy. So if I'm talking about a SNAP policy, for example, and I'm saying a lot of these messages about how we know that this policy could have a disproportionate impact on people based on the policies that are shaping the way they're currently living and the options that are available to them. So if we could work with our local communities and government together, we could make this policy most effective. So for example, we could specify that policy benefits would go to this community for this reason, or people living at, we would set these criteria based on what we're seeing in our community for this reason. We can only do this if local communities and local government can work together. Local residents want what's best for their communities. We need to listen to communities to create solutions. Please work with us to make this policy, most effective for and with the community to address structural racism. So it's either a conversation directly about protecting local action and local decision-making, or it's an additional layer of messaging and call to action about your particular policy that's allowing you to make an additional case for why local action is so vital, not just to pass the policy, but to make sure the policy has the greatest impact where the need is greatest. And you'll see we did the same modification on the side for our early adopters. And the difference on that side is just we go even more strongly and directly to talk about structural racism and racial equity. And you'll see that most strongly in that final call to action message that we've added on the green side, where we're directly calling out that preemption is a tool of oppression. When states strike down city laws, they're silencing the voices of people of color. And you might say in your community, they're silencing the voices of Asian Pacific Islander immigrants, or whoever your community of color or communities of color are in your community. Help us protect local action so we can make this policy and all policies most effective to address structural racism. So that's our attempt at putting these two messages together. We really, really want your input. So I'm going to stop and just, again, open the floor to questions, observations, and then we're about to go into small groups and give you these messages and ask you just to discuss and play with how would you apply this in the policy campaign that you're working on, either to directly ask for protection of local action and decision-making, or to build your case for your specific policy and the need to target that policy where the need is greatest. So you're about to have some playtime, and then we'll come back for discussion. But before we go there, what questions can we answer?
So this is Ellen again. I appreciate that there are policies where we have to do it in steps and start with where it's most needed. But there are also policies like paid sick days that are universal, that apply to everyone. And so I just want to make sure that we take into account both, but we can still make a point with it. We can talk about those who have had least access and greatest need, and why that is, again, because of systemic racist policies, and then why the policy that is needed by those who need it most will in fact benefit everyone. This is kind of the 101 of what, I think is helpful for people who were skeptical about the phrase Black Lives Matter. That one thing that wins them over is realizing that only when Black lives matter will all lives matter, and that the solutions that are needed will in fact be solutions that help the society as a whole. Does that make sense?
It does. And Rena and Allison too, if you're on here, I think this question about to what policies does this focusing where the need is greatest message apply is one that we've talked about before. Do you want to say anything about how you're envisioning this happening and working into policy bottom lines for which policies?
Hey, it's Allison, and I'll certainly have to give it a little more thought, and Ellen, I appreciate that. What I would say is, yes, paid sick leave would benefit everybody, but it's certainly going to benefit those most in need right now than it will people who already have that. So who already have that coverage because of where they work or what level they work in or how much they get paid. So just as I look at sort of my own life and who would benefit most from paid sick leave, it's those, employees that are most at risk. So I think even though the policy will benefit everybody, it certainly will benefit some people more than others right now. So I will think about it more in that direction. And yeah, I have to give it some more thought. Rena, I don't know if you have.
Let me just add one more example of what I mean. It helps everybody. The pandemic has totally reminded us that those of us who have paid sick days come in contact with those who don't and get sick. And so it does benefit everybody while having the greatest impact on those who need it the most. And a second way that it does is it helps change the culture. How many of us know people who have that time but don't dare use it because they'll be seen as uncommitted, undedicated? And this opens up a way for them to talk about using the policies they have to make them more effective.
Yeah, I think that I don't think we would disagree with anything that you said there. And I think that's the kind of massaging of the messaging you need to do to make it specific to your issue. I think most of the issues that Voices is looking at and supporting would definitely, we want to make sure go to those communities most in need first. For instance, we're working on bike and pet appropriations. We want to make sure those are going to communities that have been disinvested in for many years rather than communities that you know, already have great sidewalks and walking trails and things. So, but I think that comes down to the personalization of the messaging. Jennifer and Shakira, I don't know what you would say there.
Jennifer, you want to weigh in?
Sure. I mean, I think the personalization of the messaging is really core. And I mean, you all are the experts on your policy and your community. And Ellen, the points that you're making about, I mean, you're taking these messages and telling that story in exactly the way that you would need to make this work on paid sick, for example. So, I mean, that's a huge point that we'll make in the message guide that goes along with these and the questions you're asking are really great prompts for us to put in the guide for other people to ask as they're thinking through this.
Yeah.
Go ahead.
This is Rena. I was just going to hop in. I was just going to say that too. I think just, Ellen, that's really helpful. This is exactly the kind of conversation that we want to have. So as we're fine tuning this and putting all the pieces together, we're thinking about these questions. And just one thing to remember, as Allison said, this is a framework. And so we hope that folks will take it and tweak it and use it as you need it. But again, as these examples come up for you, even if you're sitting with it tomorrow or thinking about it later, shoot us an email because this is all really helpful as we pull together the final version of the guide and different examples or questions that we want to be thinking about. So thank you.
There have been some comments in the chat about not using jargon. And we 100% agree with that and have really tried to pull this out of jargon and into conversation. And it's a lot of the reason that we're testing these repeatedly with people within the Voices for Healthy Kids universe and also with policymakers and policy influencers. And we've been refining them throughout to respond to what people need to talk about. So I would love to hear if you want to share now or discuss in your small groups and then bring back what is still striking you as jargony here, because we can address that both in the messages. We've also had a lot of requests for a conversation guide that would show like, how would I actually take this and weave this into a conversation with all the nuance and back and forth that might happen. And we can illustrate some of that too. But does anybody want to weigh in on what's feeling jargony here? All right, well, please, if you can talk about that in the small groups and bring back, that would be super helpful. Sarah, I see your comment about some of the pushback that you anticipate seeing in the South about how increased regulations at the local level inhibit business. That's a big pro-preemption argument. And I think we can look at that both from, I'd be curious about what the insights from Hadaway's message testing might give us there. Allison, Rena, I don't know if you have any insights on that question based on what you've seen in the other messaging.
Yeah, no. We can. Yeah, go ahead. I think we can bring some stuff back to you. I can pull it together and make sure that it goes out to the group because we have done specific messaging that have dived in and worked with others that have done specific, like LSSC with conservative lawmakers and. In reality, you know, preemption, you know, conservative lawmakers should love smaller government and local decision making. So that they flip that argument when they don't like the issue is, you know, sometimes a red herring. So there's only so much we can do to push back on people who are finding arguments on both sides of the fence. But we certainly have some that we can pull up and put out to the group and make sure that you have it available to you. Rena, I think I stepped on your toes when you were going to talk there.
Nope, we're good. Thanks.
Ben is raising a question that may have come up in your conversations on Tuesday, because I know it's such a big issue in preemption, where sometimes we actually like preemption because it can actually be used to advance equity. And again, Allison, Rena, or others, I don't know if you want to weigh in on that comment based on the preemption specific message research.
Yeah, no, I think we need to be clear about when we're talking about ceiling preemption and floor preemption. I think that we have seen, I mean, we can just look at the Civil Rights Act of '68 to talk about when it's important to set a floor and sort of what communities need to do. But what we're seeing more and more of is that the ceiling preemption that won't let anyone go further. So being clear and knowing what preemption you're talking about is super important. Being able to talk about what the differences in preemption are, and out of the larger research project, we'll be able to get you some of that.
And Spencer, thanks for your comment there too. I'd like to send us into small groups just so you can get in an environment where it's a little bit easier to chew on this together a little bit. I'm going to pop one more time in the chat the PDF that just has these messages. It's what you see on the screen here with some of those additional proof points built in. And what we'd love for you to do is just try, you're just gonna have like 15 minutes, but in your group, try customizing this message frame for your issue or campaign. And you might decide to pick one issue or campaign within your group and workshop it together. And as you're doing that, just dig farther into what's working well, what's kind of bolstering the conversations that you're having or want to be having. And then what are those other points where it's feeling tricky, both on the preemption specific angle and on the talking about racial equity and asking for specific provisions angle. And then just in general, the racial equity components. So we'll work together in small groups for about 15 minutes. We'll come back and just have about 10 minutes for sharing and discussion. So every group won't do a report out, but if there's something particularly chewy in your group that you feel like it would be interesting to share, we would really appreciate that. And then you'll also have a Voices for Healthy Kids staff member in your group who can bring additional comments back to us as we're finalizing. So I think with that, we're ready to go into small groups.
All right, I think that is everybody. All right, so we're gonna spend the next few minutes just having a full group share out of some of the issues that you were able to try the messaging on, and just talk about what you were chatting through in some of your breakout conversations. So anyone wanna be the first brave soul? Oh, someone, can you all hear me? Ken says he can't hear me. Okay. Looks like others can hear me. All right. All right. Did anybody want to jump in and just share out from your breakout group? And a gentle reminder to introduce yourself when you share out. Anything that stood out is really interesting in terms of how to apply the messages to a specific issue?
So this is Betsy. I'll go. I'm Betsy Vetter. I'm the Field Grassroots Director at American Heart, and had a small group of my colleagues from up in the New England area. And we really looked at those messages, mostly the ones I think that would target skeptics, because they have these states were pretty conservative legislatures, and just talked about how we could maybe use them and not find ourselves saying anything that would shut a door before we open the door with them. So I think, I still think there's probably work that we all need to do, and we probably could have talked about this for quite a while. I do think there was agreement that like a conversation guide would be helpful. And I was the one who had put, the stuff about jargon, and my experience has been that with certain folks, if they're not there and they're not understanding the words, so structural racism is the words that struck me. If you have skeptics or people that are super conservative, don't necessarily agree with it, or even maybe potentially lawmakers who passed the policies that we're talking about need to be corrected, like how things impact them when they hear those messages, and what we can do to make sure we're not putting up a wall, but we're actually opening a door to a conversation. Because sometimes depending on, who you're talking to, it's very, very difficult to get them to understand where we are and why. So that was the kind of conversations we had.
Great. And Betsy, in your conversation, when you talked about, thinking about ways of entering the conversation without having the door closed in your face, did any examples emerge?
We didn't talk about anything specific. Mostly it was more to talk about just that whole concept around local control and how that's perceived, and whether, you know, from a state perspective, if we're talking about state lawmakers, you know, do they perceive their state as a place that just doesn't have local control? We're not a local control state. So, you know, like, why are you talking to me about local control versus a state that might really value it? And that you've got to be kind of sensitive to that. So to create your conversation with kind of the open eyes of that, so that you construct it, so that you keep moving forward.
Awesome. Thank you. Any other groups want to share out? Anyone else from another group want to share out?
Lori can jump in here too. In our group, we talked too about when is the appropriate time to have the conversation, even if it means that you might get a door closed in your face, like Betsy said. You know, we talked about the need to have these conversations, to use some of these exact words over and over again as we bring people along. And sometimes it may be worth losing the short-term battle and winning a long-term war in terms of addressing these issues more upfront. I don't know, Lori, you probably will say it a little better than me.
I won't say it better, but just with some older advocate context, having started in tobacco control in like the early to mid 90s, and people didn't want to talk to us. And that was Massachusetts. They didn't want to hear about secondhand smoke, God knows, but they certainly didn't even want to be talking about cancer and the impact on kids and the influence of marketing. And it took years going back and having the same messages over and over again. The audience didn't change that much. We stayed pretty consistent with our messages. And I think around the country, like, we just had to wear people down and convince them. And when I think about, you know, what some of our colleagues in different parts of the country have raised at different points, like, is part of our job right now, and I think it is, but I'm one person, is part of our job as a movement of people who are committed to ending systemic racism or playing our role in it. Are we going to be the ones who are willing to be the first round or second or third round of waves of communications to these lawmakers, to a point where, like, they're going to have to respond to it. They're going to have an answer for it and react to it. And just look at all the different organizations that are participating in preemption around the country right now. Like, it's a ton, from the very moderate to the very progressive, and maybe there's a couple sort of conservative-ish ones in here. If our audience of lawmakers was hearing from all of us about the importance of this, it provides some political cover too. I think we've got to remember, it's not just like convincing them that they need political cover. And I'm just really intrigued by that part of it. And I'm also super aware that I'm in a position of a lot of privilege right here, not being a lobbyist and I'm not on the front lines anymore. Nobody's pressuring me to pass a bill. And so I'm also sensitive to that, but also very, I don't know. I feel like we're at an important point in time to use our power collectively to change things, and our voice and messaging and speaking that truth over and over again feels like part of our opportunity and responsibility.
Awesome. Thank you for sharing that, Lori. As we're coming up on the final couple minutes here, I'll just ask one quick question that I don't think we've had a chance to explore, but what do you anticipate working really well with these messages? Anything that stood out as potentially working well? Or
Shakira, I'll jump in again just because I can't stand when it's so quiet. But what I've loved about this, and I've had a chance to look at them for a few days now, is balancing out and really talking about the collaboration of state and local government. And I feel like the way that little bit of the message frame to me, and using, you know, state government as sort of foundational, it's not pitting one against the other or saying one is better than the other. I like that a lot, and I'm curious to see how that works in the real world.
Awesome.
And Lori, it's Dave Day from Heart, and Lori, I too hate the silence, so I have to comment on something. And you know what I think is going to work really well with these is that these messages are being developed from research that we've done with the people who we're trying to deliver the messages to. And what I think we all too often find ourselves doing is we say the things that we think are going to resonate, whether that's accurate or not. And so I think what's going to work well here is that again, we're saying things, we're being trained to say things in the way that people want to hear them versus what we think that they need to hear.
Awesome. Well, we are coming up on our last minute, and I want to respect everyone's time. We just quickly wanted to provide you with a summarization of what's going to happen next. Jennifer, you want me to share the screen? I can share the screen. Okay, awesome. So we are going to finalize the messages rollout and training in December. And then we'll finalize the full guide for release in January, which will include the messages, racial equity background, and a glossary, responses to anticipated oppositional points, some recommendations around words to use, avoid, building racial equity into your policy campaign, and links to other helpful resources. And then for you, we just want you to prepare to be ready to use and share the guide, and then to give us some feedback and let us know how it is working with you. So just want to express immense gratitude for your time this afternoon. Really appreciate all of the input that everyone has provided, and we'll be excited to share the full guide with you all in January.
And thanks, everyone. I just wanted to check really quickly on Whitney's question in the chat, because I think it's a great one. And one of the things that Shakira just told you was that there'll be a glossary along with the racial equity background. Whitney's asking about the fact that some nonprofits are using the term white supremacy. We didn't test white supremacy. There are a lot of different ways to talk about systemic racism, structural racism, historic inequities. There's a lot of language being used. We're following the lead of what the Heart Association put out in its President's Advisory and what Voices for Healthy Kids have been using, which is structural racism. In the guide, we'll address all these different terms and how they're being used. Reading that I've done indicates that, especially with conservatives who may not quite be there or might even be denying the existence of racism and historic racism, white supremacy is perceived as a very blaming and labeling term. And so when you talk about structural racism, you're able to talk about how we live in a world that's been shaped in a certain way since white people arrived in what is now the United States. And that is the context that we all live in. And it's less about labeling individual people as white supremacists or racists, and it's more about acknowledging the environment we live in has been built in a way that advantages white people over people of color. And most of our respondents in our survey, including lean conservative, understand that white people have benefits that people of color do not have. We at least are in agreement on that. That is white supremacy, that is structural racism. And if you don't want to call it that, but you still recognize that that's where we are, that's an entry point, right? So I think that you are going to be reading a lot of your local context and what you're able to talk about. Here in Portland, Oregon, I can talk about white supremacy in a way that in Indiana or Arkansas or other places where your lawmakers are more conservative, you probably can't. And so a lot of this is reading your audience and understanding how far you can push these messages. I think that for me, the bottom line, somebody asked in my small group, like, is the blue column sort of the minimum starting point? I don't know that we're defining it that way. But the point is, you've got to be in the conversation. You've got to find a way into the conversation. These messages work with people who lean more conservative as well as people who lean more progressive. And as Lori said, it's if you don't have the conversation, even if it's hard, if we all shy away from it because it's hard, the conversation will not change. So we really, really, really encourage you. We're going to support you in every way we can to really dive in strong on this. We'll address that in the guide. And we're so eager for your ongoing feedback. So I know you're going to keep working together today. More of this will probably come up. The Voices team will share it back with us. And thank you so much for the conversation. Really valuable for us.
Thank you so much, Jennifer and Shakira. We'll give you a Zoom round of applause. Appreciate your time and expertise in being here with us today.
Thank you all.
So thank you. I'm going to ask all of you to hang for a few more minutes before we break. We wanted to just, if you can keep your brains moving for like 7 more minutes, we wanted to just as a group actually hear from all of you, just as Jennifer wrapped up to her point, is what do you need as we, as voices and all of us think about the health equity guide and the messages that we just talked about, the Hadaway messages, and specifically on preemption, as we think about rolling out both of these resources to all of you. And as we think about the technical assistance, additional supporting kind of wraparound resources, trainings, what do you need? What is going to help you? We've heard conversation guide. What's going to be helpful to all of you to use this stuff? And in both pieces, so we can kind of ping pong back and forth between the Hadaway messaging and the Met Group guide that we talked about today. And so I'm going to ask people to throw things in the chat, come off the mic, whatever you prefer, and we kind of just want to do a collective brainstorm. And if something's not clear, I'll ask you to clarify just to make sure we capture it correctly. So Betsy, you mentioned a conversation guide, so I'm going to put you on the spot first, if you don't mind. Could you talk about elements of that conversation guide? What are things that you're looking for in that would be helpful?
I think, helping people how to construct their conversation and kind of carry it through using phrasing that will help people, as best as we know, because I think Lori's made a really good point. I remember when people thought I totally made up food deserts and that I was a crazy person. But anyway, that sort of helps them talk to you more about it, where they are, because I think it's through that communicating that we start to make paths forward. I think the other thing that I think is really helpful, on a day-to-day basis for staff is as much as we can to bring things down to, like, I love the documents that Voices has, that Heart has some of these that say, instead of saying it this way, say it this way. And it's like phrasing that you can just kind of plop in. And if you can just keep practicing it, you get there, right? Yeah. And so I think there's a lot of things over the years, like we learned to stop saying smoking bans and, that kind of phrasing. Yeah. It takes us a while, and we still, sometimes struggle with that. But I think the more of that we have helps build those conversations in the right direction. So those things to me would be incredibly helpful, because this is a little more complex and harder, and it just is going to require us to practice.
Yeah, that's great. I mean, that's one of the things that we've been talking about, just so folks know. We've been thinking about, can we kind of create those opportunities for us to practice with one another and work through it? And Danielle, I see your note about learning best from your colleagues' experiences. And I think what we would love to do kind of long-term beyond the practicing is, once folks do go out and hopefully are using the messages, can we come back together and talk about our experiences and how they went? So kind of tying those two pieces together of what a little bit of practice, applying it, what tweaking do we even need to think about, and what tips and things can we share with one another? And maybe we even think about doing that, whether it's by issue or even regionally, given everybody's environment is different. And Danielle, I also see your note about a case studies. Stephanie Vaughn and I were just talking about that yesterday from Hadaway, and actually thinking about, from our end, when we write case studies, maybe writing them differently, more using the framing that Hadaway laid out with some more stories and things like that. So if any of you are working on preemption campaigns that you'd love help writing up, please let us know. We would love to help you do that, and it could be a collaborative process as well.
There was also a mention in the chat about infographics and helping.
Oh, great. We will put infographics on our list. Thanks, Allison. Other things that might be helpful, resources, again, trainings, conversations, doesn't always have to be a piece of paper.
Yeah, Rena, we had talked a little bit in our group about, or I guess I brought this up, I should say, with some of the training we're doing for, our development staff within the AHA, on our issues and trying to, better, I guess, explain what we do and help them be able to better explain what we do within advocacy, having some specific, one pager or training guide or something that would be specific to being able to talk about this issue, for them being able to talk about the issue might be helpful.
That's great. Thank you. Other ideas? Oh, hey, Robin.
Hi, this is Robin. Yes, my youth advocates, they want to have a separate training. So I don't know if there is a different language for, you know, younger advocates. I've been thinking kind of, you know, trying to think that through. So I'm going to leave it there, right?
Yeah.
So voices for just younger advocates. I'm finding that sometimes we have to change, of course, change the messenger, but it's almost like changing the message so that they can be inspired, I guess, to advocate for the, you know, repeal of preemptions and the prevention of preemptions. So, yeah, that's kind of my challenge right now.
Robin, could you give us an age range that you're working with?
Yeah, so we're talking about, you know, high school seniors to college. You know, we want to really start to mobilize our college chapters, and then our high school students. They're eager to take on some policy, you know, some policy fights, right?
Yeah.
And so they understanding that the state of Maryland it looks like we're trying to become more locally controlled, but the state keeps you know, preempting things that we win, right? That's becoming more evident here in Maryland. So I just need something different that's going to inspire, you know, inspire them to turn protesting street to, you know, fighting for good policies and bringing that locally, if that makes sense.
Yeah, absolutely. I'm also going to ask folks, if you're doing any youth engagement or have good tips, can you put them in the chat box for Robin, or at least put your contact info so maybe folks can also connect after this and have a longer conversation about that. It's a great point, Robin. Any other ideas for us or things that people feel like would be helpful at this point? All right, well, we are here. You can always find any of us, talk to your policy engagement manager, shoot a note to Allison, Lori, myself, Annie, anybody on our team, and let us know as you think about this. And if you have further thoughts on any of the messages and communications we've had over these last couple of days, please let us know, because as we said, there's still drafts, and this is kind of part of our testing process. We have previewed it for all of you, you know, on purpose. We want to know what everybody thinks, because we want to refine them and get them to a really good place before we formally release them. So with that, Annie, I'm going to hand it over to you to talk to logistics about the rest of our afternoon.
Okay, great. So I'll be very, very brief. We are, like Annie mentioned, in the home stretch. And so we're going to jump right in. I'm thrilled to have our friends from We Collab here with us today to discuss equity-centered practices for coalitions. So I'm going to immediately toss it over to Samia. If you are ready, go ahead and take it away.
Hello, everybody. Thank you, April, for that. I am going to share my screen. So if you all can just give me a second to jump in. See if we can get this on full screen. Sorry about that. Give me just a sec. Okay, let me know when you can see that on presentation mode. Okay. So thank you all for having me today. My name is Samia Mirza. I'm with We Collab. We've spent the last couple of days talking about preemption and the messaging around it. And I know that it's come up a few times in the first session around really the equity component of it. And all this morning, you all have been talking about messaging preemption from the lens of equity. So in our conversation today, we want to take that a little bit further and talk about not only the words that we're using, but what are the actions that we're also taking within our coalitions to make sure that the messages are equity driven, but the person giving the messages, the people that are in front of the room, the people that are carrying this work, that all of this together is really driving equity, and it's not just the words that we're saying. So in our conversation today, we will do a bit of background about how preemption is a threat to equity in our equity work as a group here. We'll go into some of the coalition building tips. We'll do a breakout session for 15 minutes, and then we'll come back and talk about engaging elected officials and follow-up and feedback loops after that engagement as well. We'll do another breakout session and then debrief and closing. So that is our session for the day. So just a little bit about We Collab before we jump in. We are a social change organization. We work in the nexus of policy and practice. And I think one of the big things that we definitely want you all to remember is that we are a TA provider for all of the Voices for Healthy Kids grantees, which means that if you all are grant holders through Voices, you have access to We Collab in terms of technical assistance, trainings, and anything that you really need for your campaign to be successful from the lens of equity. You can turn to We Collab and you can really go through the Voices system to request any services that you need from us. So that is a part of your grant with Voices. So I definitely want to make sure that you all are aware of that. Before we actually jump into some of the conversation around how to really utilize our coalitions to drive preemption through equity, I want to talk a little bit about how preemption really impacts our equity work. And to do that, we need to start to really look at what preemption is. As you all know, and it was stated in the first couple of sessions, that preemption really started off as a policy tool to really create floor minimum standards. So minimum wages, minimum standards in work environments. And so that's how preemption really got started and was the purpose of it. But over time, that's really evolved. And it's no longer really this neutral tool that's used. It's become a way to really transfer power from local governments to state governments. And it's created this vacuum of power that's really taking all of that from the local government and local communities as well. And what we're seeing is that these specific policies that are being preempted are disproportionately impacting women, people of color, and low-wage workers. And we'll go through a little bit more on the statistics of what kind of preemptive policies we're really seeing rise up. But as you all know, that these policies are not the policies that are designed to preempt large businesses or preempt the wealthy. It really ends up being policies that preempt the ability for people in low socioeconomic status and other really just largely community members' ability to not only be healthy, but able to thrive in their communities. And the other thing to really note here is this this evolution from preemption really being used to create floors is really also going hand in hand with a lot of what we're seeing in our democratic system as well, in terms of the shift and transfer of power. So in the same way that they're shifting for public health, they're also shifting for the democratic power of gerrymandering, campaign finance abuse, limiting ballot access, voter suppression. It's really that same type of, it comes from that same backbone of removing power from individuals and local communities and really raising that power up to the state level to be able to make decisions for a larger group of people. And then the last thing is the sweeping state laws that intentionally, extensively, and at times punitively bar local efforts to address a host of local problems. We know this through tobacco. We know this through a lot of the so-called bathroom bills. We've seen this in many different areas where it's really being used as a tool. And I keep saying this because part of when we're talking about this messaging and we're talking about how to present the concept of preemption, we really do need to think about the impact that it has on local community members and specifically our work in equity. So in a very kind of basic terminology, health equity is about creating the opportunity for people to live their healthiest life. Obviously, we know there's a lot more to that definition, but I want to kind of keep it at this very general level here. And many of our organizations, I know Voices for Healthy Kids, but many of our organizations really have this health equity mission as a part of the work that we do, that we want to decrease or eliminate disparities, and we want everybody to have an opportunity to live their healthiest life. And the way that we do this is by creating policies and programs and interventions that are based on the needs and circumstances of each community, city, or locality. Meaning, we're really looking at the circumstances that exist. And when I say circumstances that exist in a community, that could be anything from systemic racism that has occurred over generations. That could be a set of particular policies that were intentionally designed to harm or hold specific people back. It could even be that there is a large-scale catastrophic weather event that happens, a hurricane or a tornado happens, and that demolishes systems within a city. It could be that there is a large-scale economic downfall and that impacts a certain community in a different way than another community. And I'm giving these examples because it's clear that we cannot apply the same type of intervention or program on every single community across the state or country for that matter, because there are specific circumstances. There are policies, there is a built environment, there is the people and who they are as people and what their needs and aspirations are that differ from locality. And so as a group, all of our organizations are working to create these policies and programs and interventions that all hopefully collectively lead to health equity. So that's our goal. Preemption is the complete existential threat to equity, because what preemption is saying is we no longer want to give you the ability to create those tailored policies, programs, and interventions. It's taking that ability away. It's taking the ability away to say, in this particular community, these particular people are facing this type of situation. They're finding themselves in this type of circumstance. And therefore, we want to create an intervention for that. It's taking that power away. And so, although we know that preemption is really important, I want to really like hone in and hammer in the fact that in order for us to do any of our equity work, whether that's in tobacco or healthy food or active living, whatever our work is in, preemption is going to stop that from happening. And so these policies and the way that we frame these preemptive policies is really that it's taking our ability away to reach our goals of creating opportunities for people to live healthy, our goals of eliminating health disparities between communities. So I do want to tie that in there together. So let's take a look a little bit deeper and talk about how these policies actually are impacting structural inequities. So first, preemption removes the opportunity to take action to remedy inequity through policy change. Like we talked about, it doesn't necessarily take our ability to implement programs or like place-based interventions, but it does take away our ability to make any changes through policy. And as we know, policy is really what creates a lot of the long-term systemic changes that are required for this work. Secondly, populations of color are most reflective in representation happens at the local level. For those of you that were a part of the conversation that took place 2 days ago on our first day of this convening, Sarah Mann had done a great job of listing out some of the stats. But for those that weren't a part of that, the idea is that local government is where most of the representation happens for communities of color, for women, and other communities. Though even in local governments, it's often not as reflective as it needs to be, proportionate to population. It is far more reflective than the state level. We know that state level governments tend to be white-led, male-led, and are not necessarily representative of all the communities within the state. And so what ends up happening is that when we're trying to create policies and interventions for a local community based on that local community's need, their needs are no longer being reflected by people at the state level. Whether that's because they are not proximate to those communities, they don't have the lived experience, they have their own personal priorities that they're trying to focus in on, whatever that might be, it's that the representation isn't there. And so the need to create and keep the power at the local level is therefore even more important. And then after that, when we really start looking at the policies that that preemption really impacts, and we look at it from the social determinants of health. So as you all know, social determinants of health includes economic stability, education, social and community context, health and healthcare, neighborhood and built environment. So those are all of the different factors and different determinants that make up all of the ways that a person's health is impacted. So these are the policies that fall within those different factors. So you see we have 25 states that preempt minimum wage, 23 states that preempt paid sick days, 9 for banning local fare scheduling laws, which is essentially requiring that schedules are made in advance for people, that schedules are not changed the day before, and people know what their work schedule will be, that there are certain requirements for canceling. That's what fare scheduling is. There's 5 state bans on ban the box, 34 blocks for local rent control laws, 45 on local regulations of ride sharing companies, and then even regulations on 5G deployment. And then if we look at specifically for tobacco and nutrition preemption, there's 13 states that ban local food and nutrition policies, 11 states that ban local action on e-cigarettes. So you can see that that preemption it's basically chipping away at all of the different factors and different factors that make a person's health. It's not even just about healthy food policies or active living policies or tobacco. It's really about a family's ability to earn for their families, to be able to have stable income, all of which we know impacts health, all of which we know disproportionately impacts communities of color, Black, Brown, as well as low socioeconomic communities. This chart here I found to be really interesting. This shows over between 1993 and 2019, the use of preemption laws or the passing of preemption laws at the state level. Now, this is not fully comprehensive. You can see from the chart here, this covers gig economy, minimum wage, soda taxes, fare scheduling, paid leave, plastic bag, single-use plastic bags, and short-term rentals. But I think what's really, really fascinating and interesting here is that starting in 2013, well, before 2013, predominantly the minimum, the laws that were passed for preemption were minimum wage. So we're assuming that these are all establishing minimum wage. After 2013, we start seeing this really big uptake of the use of preemption laws, predominantly around the gig economy and around fare scheduling, as well as single-use plastic bags. And I think the gig economy piece of it is really big. Obviously, this is when the types of gig economy jobs, specifically Uber, ride shares, but also entrepreneurs that are consultants and all of these types of jobs really perpetuate this system of not being able to have the control and ability to earn in the way that you want and create the standards that you want, with all of these preemptive gig economy laws being passed. So we see in 2015, 2016, 2017, this sharp increase. And then in 2018, there's a sharp decrease. So 2018, we know that there was a midterm election. There were a lot of shifts in state governments at that time, and state legislatures at that time. And so that's where a lot of this kind of spike falls down at. But I'd be curious to see how this continues to go over the next course of the years. Hopefully with our work, we can make sure this keeps coming down as well. But this is just a really great representation of how this has all of a sudden exploded, and the use of these types of laws have exploded over our time. So before I jump into talking about the really how we're going to utilize our coalitions to make an impact here and ensure that equity is a part of our processes, I'd love to hear from you if you had any comments or questions about the information that was just presented, anything you want to add to this. We're all definitely here for peer learning, and you all are experts in this in your own right. And so if there's anything else that anyone wants to add or ask questions about before we move on. All right, so we'll go ahead and move forward here. So as we think about how do we work beyond just the messaging, I really want you all to think about how do we utilize our coalitions as a part of not only the messaging, but how are we ensuring that our coalitions are created, built, and supported in a way that is promoting equity, and therefore then will also promote the equity message, and therefore will promote the banning of preemptive laws. So first, when we're looking at our specifically a preemption coalition, I want to talk about communities of color and how they should be centered and included as a part of these coalitions. This obviously is not just about preemption. This is in any type of coalition that you have. This should be true, where communities of color are included and they are centered in the coalition. But I think specifically when it comes to preemption, given the information that we just talked about and the data that we just talked about, it is very critical for these communities to be a part of the work that we're doing, and not even just a part of it, but leading it, and that we're partnering and really ensuring that the power is resting within the communities themselves. The second piece is an opportunity to create unlikely partnership with advocates with opposing views. So preemption is an interesting topic because it has little to do with personal opinions or perspectives about a topic, such as, let's just take school foods, for example, right? We can have two different opposing views of what it means to have healthy foods in school. You know, I can say that I think all vending machines should have healthy food, or somebody else can say no, vending machines should stay, and the food should have that's in the lunch line should have nutrition standards, and we can even debate on the different types of standards. But our ability to even debate is what's being taken away by preemption, right? And so this coalition around preemption is an opportunity to really start partnering with people that you might even have opposing views on these issues, but you want to bring them into your tent to say, for us to even have the debate of what our opposing views are, we have to stop this preemptive policy. Otherwise, we can't even have a debate at our level if this policy exists. And so this kind of a coalition can really expand your tent. And what it does is it also gives you an ability to build relationships so that when it is time in the future to start working with these people that have opposing views, or these organizations with opposing views, you already have some type of relationship built with them, which will then make the rest of your work even easier to do really with those relationships built. It's like having a common enemy almost that you can really rally together with for that time being, even if later you're going to have opposing views on something, but it builds some relationship there. The third here is an opportunity for bipartisanship. Similarly, the preemption is really not about partisanship. I think it has become used as a tool, specifically when we talked about around taking local power in our democracy and in voting. And so it's kind of, being seen as bipartisanship, or in some places being used in that way, but it's really not a bipartisanship issue. And so to the extent possible that you're able to open up a coalition and really start building bridges via this, this issue area can be really helpful for you in the moment, but then also in your future work as well. The next one is young people can be introduced to advocacy through this issue. I think that, preemption, again, because it is this broader issue of your ability to have power, is something that young people can also be introduced to. If they don't maybe know the nuances or haven't yet figured out where they fall in their views on certain issues, this is one that can be something that you introduce the youth to advocacy through, bring them in a part of the coalition. And then the other interested stakeholders. I know that in the first day, you all talked quite a bit about who else would be interested in these types of policies. We talked about teachers, we talked about parents. And then I believe it was Betsy that had brought up the local officials as stakeholders as well. And I think that was a great idea and a great thought there. But, we have to really kind of look at who are we taking the power away from, or with a preemptive policy being passed, who loses the power. And it's definitely local officials lose power. Obviously, communities lose power because their voice is being stifled. And so really kind of looking at who else would be interested beyond the issue area, whether we're talking about tobacco or food, just the idea of preemption, and how can we bring people into the tent there. The next is to utilize your coalitions to educate people about preemption. I think one of the biggest things about preemption is that folks don't realize that it's happening, or that it even can happen. There's a lot of misinformation about who has jurisdiction to do what. And I think April had brought up earlier today about COVID being an eye-opening experience where we really kind of saw this entanglement between, well, whose job is it? Whose jurisdiction is it? Is it the local government? Is it state? Is it national? And we saw some renegotiating happening there for sure, but there was also a sense of we actually just oftentimes as citizens don't know, and then it also differs by state to state. And so in order for us to really get the attention of people and let them know what's happening, we need to be educating them on what preemption is, how it exists, how it impacts them. And I think that what ends up happening is preemption policies end up being passed quietly, kind of at the state level between a few people, kind of closed doors, and that really is only possible with a public that doesn't know about preemption or doesn't understand the implications of it. So the more that we can educate our coalitions, educate the community members on what this actually is, it'll be that much more important for us to raise the attention that we need. Preemption, I think, is an important different kind of issue area because it's not about necessarily, like I said, about a perspective on an issue. It's really about power and about a transfer of power. And so legislatures aren't always necessarily motivated on, the impact of this on that specific issue of tobacco, food, whatever it might be, as much as the power transfer aspect of it. And the only way to really get their attention is for people to get their attention, to say, hey, we see what's happening. We know what's happening. I think a really good example of that kind of in the last few years has also been on the social justice system. I think people had a lot of blind faith in that there is a system, and that system is working how it's supposed to be working because it's a system, and really shining a light on the flaws of that system, I think has created this level of awareness where now people are saying, we want to hold folks accountable for this broken system. And so in the same way for preemption, there's a need to shine a light on, yeah, there's a system that allows a policy like preemption to happen. Yes, that exists and it's legal. However, it doesn't mean that it's serving us. And these are the flaws in it. And this is how it's impacting you. So that awareness is very, very critical. And then the next one here is about building, transferring, sharing your power. Specifically when it comes to coalitions, like sharing power has become this buzzword. And I think that people say it and they say it's important, but then it's hard to really tangibly know how you're actually doing that. Like, what does it actually really mean to share power? So I have a few questions here that kind of can just help you think through it a bit. So first, it's who's leading the coalition meetings? And that's important because who's leading the meeting, there's a level of power that's coming to who's leading it, whose voice is being heard, who is being seen in front of the room. And so allowing somebody else to lead the meeting, especially if you're a national organization or a kind of larger organization, allowing a local community member, allowing somebody that is representing the community directly to lead it is a major transfer of power. And it's a major, like, unspoken form of communication around who you're seeing as important and whose values or whose perspective you're valuing as well. The second one is who's setting the coalition agendas. Again, I know as larger organizations, we kind of come in with an agenda that we know that we want to stop this preemptive policy. We want to do it by this date, this legislation session. And so we have these goals. And so that's kind of this overarching agenda that we come in with. But how do we allow the people in the coalition to create the agenda and to really, not just like for an individual meeting, but the coalition's agenda as a whole? That's another way that you're transferring power and sharing power, is to allow input in that, to allow a collective say in that. Whose ideas are being heard? Often, we want to open the floor up for folks. We want to say that we're being collaborative, but then at the end of the day, whose ideas are we really taking? And so that's another place to kind of consciously stop and say, well, this is a place that I can build power, I can share power, is making sure that people's ideas are being heard, that they are being considered. Heard is one thing, but actually considered and acted upon is a whole nother thing. And so that's another form of how you can share your power. And then this last question I have here is, are the majority of the coalition members national organizations, or even just large scale organizations, maybe statewide? Or do we actually have some coalition members that are, neighborhood association and a PTA and just local advocates that are representing their neighborhood or their county? Or so we have to really look at what the makeup of our coalition is as well. And that's a way of transferring power locally as well. So we're talking about this preemption as an idea of taking power from local to state. I think as organizations, we also need to really kind of look in the mirror and say, how much power are we taking away from local advocates and kind of doing the work on behalf of, versus making sure we're keeping the power with local advocates and in communities and working beside them. So I want to take 15 minutes to do a breakout session here. These are going to be questions, and I will drop them into the chat box after we break out, but I really want you all to learn from each other. Like I said, you all are experts in the field and have been doing this work, and so peer learning is super, super important. So one, I want you to share examples of unlikely partners that have joined your coalition for preemption. And what was your process in building this relationship? How did you manage to get them to join your coalition and be interested in this work? And if maybe you don't have an example of somebody that has already done this, maybe you can provide an example of an unlikely partner you're hoping to include in your coalition. The second one is going to be share specific examples of how your coalition has been able to share power. This could be how you've already been able to share it, how you plan to share it, but we'd love to hear very specific examples, again, so that we can learn from each other. Often some of this stuff is we hear it all the time and it sounds like, yeah, of course, sharing power, but really understanding how it's done is what's key, and I want you all to share that with each other. So Annie, I think we're ready to jump into the breakout groups, and I'll drop these questions into the chat as well. All right, so it looks like we have everybody back. Thank you all for joining back, and we've got 30 minutes left, so hang in there with me. It's almost the end of the day, but 30 minutes more if y'all can hang on with us. I would love to hear from folks on any really interesting examples that they were able to share about an unlikely partner, or you can also share interesting ways that you've been able to share your power, either as an individual, as an organization, or as a coalition. So would love to hear a couple before we move on to the next section here. Would anyone like to volunteer to share some examples with the group?
Hey, Samia, this is Mahesh from New Mexico.
Hi, Mahesh.
How are you? So I think unlikely, relationships is like I was telling Matt, because, most of the advocacy like we do involves the state and some of the bigger cities. So with our tobacco preemption campaign, we've been reaching out to, smaller cities, smaller towns, counties, basically asking them to adopt resolutions, urging the legislature and the governor to repeal the preemption. So, I mean, this is like the good thing about this is like, you're recruiting new volunteers into your campaign, and like these are unlikely relationships if we didn't approach these folks to adopt resolution. And so, that's one thing. And also, working with public schools, smaller or bigger, having them to do the same thing. So you're finding new, developing new relationships and recruiting, new advocates for your campaign. So, I mean,
that's great. Thank you, Mahesh. Yeah. I think your point of making sure that we're including all of the smaller cities, towns, smaller school districts is really important. It can be really easy to want to go to the bigger city where you have a lot of people to really include. And I think, if anything, in this last presidential election, we've seen that a lot of these smaller counties and localities really matter as well. And so taking that time is important. Thank you, Mahesh. Anybody else that would like to share?
Sure, it's Dave Day from the Heart Association again. And one of the other participants in Group 9 raised a really excellent point, which is sometimes the bigger organizations are the unusual partner. And so, we had a case with the AHA where we sort of, not necessarily were invited to, but invited ourselves to be part of a coalition on preemption, but focused on housing issues. But it was just because we wanted to get to know what their issues were a little bit better, and gave us an opportunity to be the unusual partner for someone else. And I thought that was a really interesting approach, an interesting way to think about that unusual partner thing.
Absolutely. That's great. Thank you, David. Anybody else that would like to share? Okay, so just one kind of line that came out from the group that I was in that I really liked was that this is about preemption and not about the issue, in regards to really bringing together a lot of different issue areas that would normally not work together, but you were all working together for the sake of stopping preemption and not necessarily about our individual issues, because if it happens to one of us, it happens to all of us. And so that was really great that came out of the group that I was in. So I'm going to go ahead and continue sharing my screen here. All right. So next I want to talk about engaging elected officials. We talked earlier about the messaging guide and how to approach the conversation, which is very important. But I want to talk a little bit more about kind of some of the other communication actions that can be taken beyond the types of messaging and the type of conversation that we're having. So first is really creating the proximity to lived experiences for the legislatures. And what I mean by that is often the legislatures either aren't living in those communities, or as we talked about earlier, representation is very limited. And so that lived experience is lacking, and the understanding of the lived experience is lacking. So how can we create that proximity and create that understanding? And often that can come from having conversations with people and hearing their perspective and hearing what they go through and how the policy impacts them and their lives and all of that. It could be just exposing them to the community, exposing them to the various people in it. It could be through letters, it could be through videos, it could be through inviting legislatures into a local community and letting them meet folks there. But we have to really understand and create a way to build that proximity where proximity is lacking. And people tend to vote on policies based on their understanding of the experiences that people have with the policy. And so even when it comes to preemption, and I think this is true for any policy that you're working on, but specifically for preemption, we want to make sure that we're bringing the legislatures closer to the experiences of people. Second, and just one of the other ways I think that was brought up was around narrative and storytelling, and I think that is absolutely crucial. How that storytelling takes place, the form, who's actually saying the story, is all really important, but that's one of the ways that we can bring that proximity. Next is selecting the right messenger for the particular audience. We've often talked about, or I would say in the last few years, we've been talking a lot more about, the people that have the lived experiences should be the ones that are the messengers and that are speaking out on their own behalf. That's absolutely true. And I think that what we need to be doing even in preemption is really uplifting the messenger who can talk about how the issue affects them, how their inability to make a decision about the issue affects them. But then sometimes there is also an opportunity where the right messenger is the national group, right? And the right messenger is somebody that comes from the community of the legislature, for example, right? Sometimes there is a need to be able to connect at that level as well. And so we just really need to look at who is the audience that we're talking to, and then for that particular message, who is the right messenger. And oftentimes it won't be me as a national organization. It might not be me because of where I live or don't live, for that matter, if I'm not in the state. It might be, it needs to be particularly a person of color because they're sharing their experience with that inequity and with that disparity that they face because of the issue area. So it's really matching audience to message to messenger. Next is creating opportunities for local advocates and community members to participate in the engagement of elected officials. I know a lot of you have examples for this, and we're definitely going to want to talk about it. But how can you make it easy and create those very easy opportunities? Is it a letter that folks are able to sign on as an organization? Is it a letter that they're able to customize a little bit and write their name? Is it postcards? Is it video messages that you're easily, creating a portal where people can upload some video messages and testimonials? Is it that you're saying, on this date, on this time, I need you to show up right here, and I'm going to be able to introduce you to this elected official? Like, how easy are you making it? And what kind of opportunities are you creating for local advocates and community members to participate in this? And I keep saying this because I think often we're working as organizations, but we also have to remember that our organizations and the constituents of our organizations are individuals. And so how are we tailoring that experience and making it easy for the individual to be a part of what we're doing? And then the last one will be finding creative ways for local advocates to share their message. This kind of goes in the second and third one there, but not everybody is able to show up to the state legislature to speak. Not everyone, and especially because of COVID, we have to be more creative than ever here. But are there letters that you can give folks? Are you showing people how they can write their personal message and their personal story to share with legislatures? Is there a media campaign? Is there a social media campaign where people can add a hashtag and share their testimonial? So even if it's not an official submission to that elected official, it's still being out there and being addressed to them. So how are there creative ways, especially given COVID right now and our inability to do a lot of this stuff in person? What new ways can we create for a person's message and a person's story to reach that elected official? The last piece that I want to talk about here before we break out again is going to be about establishing feedback loops. We do a lot of work on the front end of establishing the coalition, establishing messaging, making sure that we're saying the right messages. We meet with elected officials, we transfer our message, but then there needs to be also a feedback loop on the back end as well. What are we and how are we continuing to hold coalition meetings to hear directly from people affected by the policies? How are we continually updating elected officials about the stories and the facts about the issue area and corresponding issue areas, so that elected officials are constantly hearing and understanding the impact of their decisions? Whether they voted for or against, there should be a continual feedback loop that's showing the impact of that decision made. And I think that that's true both for elected officials and then also your coalitions as well. Making sure that we're coming back and reiterating and the impact of what's happened. And then the third is the continuing the preemption education. I think from the breakouts and what you all stated is that, whether it's preemption on tobacco or preemption on, ban the box, or preemption on whatever, the concept of preemption is not going away anytime soon. And so even if we win our particular fight that we are having, there needs to be a constant education about preemption and what new preemption policies are being proposed, whether it has to do specifically with your issue area or not. We're fighting against the idea of preemption, no matter the issue area. So I want to do another quick breakout, 15 minutes before we wrap up this session. And I want you all to discuss how your coalition has created proximity to lived experiences of communities. And then secondly, share some examples of how you have promoted and supported local advocates to engage with elected officials. And I will go ahead and put that into the chat box as well so that you all have it before we go back into our groups. All right, it looks like we're all back. So just in our last 10 minutes here, I'd love to hear from you all on the conversation that you had, anything that you all want to share, part of the conversations, whether it was about how you've been able to create proximity of lived experience, and then specific examples of how you've been able to support local advocates engaging with elected officials, you know, especially in the time of COVID and more of this digital space. I think there's newer ways that this is happening. So would love to hear some of y'all's perspective on this.
Hi, this is Shannon from Kentucky.
Hi, Shannon.
I'm the state director for the Heart Association in Kentucky, and we have an active repeal preemption campaign right now. And one of the things that we have been doing is we will reach out to a specific constituent in a specific legislator's district, engage them, talk to them about it. Once they feel comfortable, we've been setting up private Zoom meetings with their lawmaker and letting them, and we're just the facilitator. So we've been the connector, and we've created a coalition now, but we've been the connector with those in the community to the lawmakers. And a lot of times you'll find that they're not, the advocates or the volunteers that you have are not super comfortable trying to set up a Zoom meeting with their lawmaker. So we've been able to fill that space to a degree and touch base. So that's our entire campaign has hinged on the idea of grassroots and how it's so important to start in the community. And if lawmakers can hear it from home and then they start hearing it bubble up and then they start hearing it at the state capitol, then we've created a little buzz around the idea of removing that law from the books.
That's super, super cool, Shannon. We were having this conversation in our group as well, that there's oftentimes, you know, people have a perspective, but it's this like fear of, am I allowed to be engaged? Am I allowed to just reach out to an elected official? Like, surely me as a normal person is not allowed to schedule a call, right? And so removing that and being able to connect them, that's super cool. Very, very cool.
One other thing that we talked about in our group was the idea that in so many ways, COVID has created a lot of challenges, but this virtual world has also created a lot of benefits and opportunities to connect people from far ends of the state to their lawmakers, or even within their own community to have that one-on-one. Sometimes they're not comfortable even going into the room, but it's been a little bit different to be on video and have a conversation facilitated by, you know, a coalition, and then there's already a relationship there. So it has played a role, and we discussed that also.
Yeah, absolutely. Absolutely. One of the silver linings of the situation that we're in, for sure. Others have thoughts on what Shannon shared, or other ideas that you all have been able to implement. Any thoughts on how you've been able to really create that proximity and share the lived experience and really uplift that message to elected officials. All right. Okay, so end of day here. I hope this has been really useful for all of you, and really thinking through the engagement of local communities, thinking through what the power of your coalition has, and the power that it holds once it's diversified, once its power is really distributed to the people that are impacted by policies. And then connecting that back to your larger strategy. So I hope this was helpful. Like I said earlier, WeCollab is available for additional technical assistance as you all need. You can work through your policy engagement team officer to get connected on that as well. So I will hand it back over to Voices team.
That's great. I think I am closing it out. I hope I am, because now I've jumped in. If anyone was planning on coming before me, I apologize. My name is Lori Frasina, and I'm the Executive Director of Voices for Healthy Kids. And I use she, her, hers pronouns. And first, I want to thank everybody for your participation in the last, Wednesday or Tuesday and today. I know it's a ton of information to take in, but it's been, my mind has just been filled with all sorts of really exciting ideas, mostly listening to all the work that you're doing. So thank you for that. You will be getting an evaluation. I know that seems like a drag to do when you've got millions of emails to catch up with because you've been with us for so many hours this week, but it really means a lot to us to really understand what is of service, what is useful, how we can get better. Our whole team is really committed to being of service to the field and helping your campaigns and coalitions be stronger. And the cross-issue coalitions in preemption have stretched us in really awesome ways, and I think has really brought our equity work to light in issues that aren't always as familiar for us in Voices for Healthy Kids. They've become more familiar in those relationships that are happening in your state coalitions and local coalitions between all of these different issue groups. I really believe is the secret sauce for our future when it comes to structural racism and justice and things we want to work on. Being in relationship with each other on these campaigns and coalitions is something the other side is going to live to regret, giving us that opportunity to organize around them. So I'm excited about that. I just want to thank WeCollab, Samia. We couldn't do our work without you, and you've been part of the Voices family and your colleagues for so long. So thank you for all you do to make this work better. The Metropolitan Group today, I thought having that presentation from Jennifer and Shakira was really helpful. And there's a lot to work with there. that's going to be tough, but we are going to keep working, and your feedback on that is going to make that a better tool that we'll continue to work with. And I really want to thank, there's a lot of staff at Voices for Healthy Kids who pull this off, but there's a few in particular. April Wallace, thank you for setting up some wonderful work here. Yui, you've been amazing. Andrea, Rena, but Annie Samagas, you are like our hero, training goddess queen who has made virtual training seem like actual experiences, and we appreciate that. I hope all of you, and actually let me thank our interpreters. And now I'm probably driving you crazy speaking so quickly, but thank you for doing this for us. And just for all of you and the work that you're doing, we so appreciate it. And I know this has been like the wackiest roller coaster of a year. And I just hope you and your loved ones stay healthy and safe and sane. And we continue to go through this transition. And thank you for everything you do to make our lives meaningful at Voices. We appreciate you. We need you. We love you. And we're looking forward to continuing our work with you. So thank you.